The next series of videos is going to demonstrate some instrument-assisted soft tissue mobilization techniques, and here's some of the common tools that we use at our clinic at Langley. So we use instrument-assisted soft tissue tools ranging from a Theracane to the marshmallow stick or the tiger's tail, an instrument-assisted cupping set, some instrument-assisted gua sha or scraping tools, some different options for self-trigger point release with either a larger lacrosse ball, smaller lacrosse ball, a homemade peanut from tennis balls, or a fancy professional-made peanut. New on the market, some massage guns. A lot of our patients have been inquiring about a lot of these. This one is a Hypervolt made by Hyper Ice. You'll also see Theragun and some other kind of off-brand names on the market. And finishing up with some foam rolling techniques and vibrating percussion foam rolling techniques. Another tool made by Hypervolt. Today we're going to talk about some instrument-assisted soft tissue techniques. So starting with some instrument-assisted soft tissue tools, which commonly you'll hear Graston tools, hot grips, some other gua sha tools. But in general, what these tools are going to look like are anything ranging from a metal to a plastic instrument-assisted tool, which is used more for superficial soft tissue and myofascial treatments. These are just some examples of some of the tools we use here at our clinic at Langley, but your overarching indication for using an instrument-assisted tool such as a Graston, a Myobar, or a gua sha tool is going to be similar to some of our other soft tissue techniques of we're assessing some myofascial either tenderness or pain with palpation, some superficial or deep trigger points. We can also use this for skin and scar tissue mobilization and just general more soft tissue sources of pain versus pain that's originating from joint or other structures. Some contraindications to using some of these instrument-assisted soft tissue tools are going to be any open wounds or any surgical incisions that aren't completely healed, any exquisite hypertonicity or superficial irritability of symptoms where the patient is just not really tolerating just regular palpation well. I might consider some other tools versus some instrument-assisted soft tissue tools for those individuals. Any other bony prominences, I'm not going to do any soft tissue techniques over those exquisitely, but my big ones are the non-healing wounds, any open infected wounds, or any other unexplained warmth, lumps. The soft tissue just doesn't feel right. You definitely want to run that by your therapist before choosing one of these soft tissue tools. So Airman Gaffney is going to demonstrate an instrument-assisted soft tissue technique to Airman Mitchell's lateral elbow. So our big takeaways from actually performing this procedure are the proper identification of the muscle that we're trying to target. So in this case, if we're working on the extensor wad of the elbow, knowing that the origin of a lot of those muscles is that distal supracondylar rigida humerus, inserting down across the carpal bones and at the wrist, and knowing which muscle fibers are running in which direction. Before we apply the tool to the skin, we can pre-treat the skin with some dual-purpose massage cream and start with just a regular effleurage kind of technique to prepare the patient for the sensation of the instrument-assisted tool. In choosing the tool, we can go by either patient preference, clinician preference, tools that fit certain contours of the body better than others. And in terms of using the tool, we're not really putting too much pressure through the tool into the soft tissues. How it's often explained is almost going for more of a scanning kind of technique where we're letting the tool do more of the work for us. So Airman Gaffney is scanning that tool along the extensor wad, and through the tool, she can feel potentially some superficial adhesions and more rough areas of the bands of muscle fibers and connective tissues that she might want to spend a little bit more time. we like to use the beveled edge of the tool facing down towards the patient. So in this case, I would like to use the open edge down this way on the skin. And generally we'll perform a few kind of sweeping techniques in one direction, in the direction of the muscle fiber, and then again working in that opposite direction versus working just in one direction for too long or just in the other direction for too long. Typical treatment duration for this can be anywhere from a few minutes to upwards of 8 to 10, similar to our regular massage techniques to get a therapeutic benefit. And really what we're looking for as a response from the patient is an overarching reduction in their pain, improving comfort with motion, improving comfort, in this case with the lateral elbow potentially, with some gripping, lifting, pronation, supination tasks. And from the clinician's perspective, improving the feel of the soft tissue, eliciting a little bit of redness in some of that soft tissue to improve a little bit of blood flow, reduce some of the superficial adhesions in the tissue. And that's often how we're explaining it to our patients as well. The technique should not elicit any superficial bruising or ecchymosis of the skin, because again, we're not putting too much pressure through the tool. The tool is doing more of the work for us. And common areas that we're typically treating with this technique are lateral and medial elbow to treat our tennis and golfer's elbow. We use it a lot in our clinic for upper trapezius sources of pain, levator scapulae. We can do thoracic, cervical, and lumbar paraspinals with some of our larger tools that contour a little bit better to the spine. But it allows a little bit of creativity and clinical expertise in how the clinician wants to apply some of these instrument-assisted tools to complement some of our hands-on trigger point dry needling, cupping, foam rolling, and other modalities. This video is to demonstrate the post-treatment effect of the soft tissue treatment to Airman Mitchell's left elbow versus her right. We can see that over the extensor wad, there's a little bit of kind of normal redness elicited in her skin, and her skin might feel a little bit warm to palpation, but we don't see any bruising, no ecchymosis, no increased swelling of the area. And after treating this area for a lateral elbow pathology, what a technician or therapist can retest is something that's concordant to the patient's symptoms. Either a resisted wrist extension exercise, a hand grip with a dynamometer, or even something as simple as picking up a 5 or 10 pound kettlebell to simulate carrying in grocery bags, picking up a heavy thing of luggage, etc. But something to make the treatment a little bit more salient to the patient and their goals.
So there are many different areas of the body where you can do scraping. This is an example of a back here, kind of the middle to low back area. Airman Paz here is just, again, moving along those muscle fibers. We see a little bit of that reddening of the skin there, drawing that blood to the surface, which is what we want to see here. We're not applying too much pressure, just a little bit of pressure, and she was checking in with the patient to see how it feels, making sure that it is comfortable for them. So the next instrument-assisted technique that we're going to talk about today is cupping. This is a typical cupping set here. There are a couple of different types of cups that we can use. This is a good example of a cup that is just the cup, only the cup, nothing on the inside there, versus this is an example of a cup with a little trigger point pressure point in the middle. So we can use these for different purposes if we want a little bit more pressure on the inside here versus just using the cup itself. So Erin Mitchell here, she has already assessed the patient. She's taken a look at the patient's muscles all the way from the upper trap there at the neck area down his back. She's identifying areas where he has tightness, where there may be trigger points, those kind of muscle balls here. All right.
Just get a good grip of it. There we go. Just see this.
So as Erin Mitchell pumps that little handle on the device there, it elevates the skin, as you can see here. The higher the number of pumps, the more elevation of that skin you get. So here's another one here. This one here has a little trigger point pressure spot in the middle there. Erin Mitchell squeezes that handle and it elevates the skin. Again, we are offloading that tissue there, helping to relieve any nerve entrapment that could possibly be in there, relieving some tension in the tissue, some possible adhesions. And honestly, sometimes this just feels good for the patient instead of being pressed on and compressing that tissue, elevating that tissue. Always want to make sure that you stay with the patient as you have these on here. As you can see, Captain Stokovich's tissue on the inside of that cup is getting a little bit red. That is a totally normal response here. We do want that. We also want to make sure that it is not too red, that we don't get those little petechiae, little spots of redness, that bruising there. Erin Mitchell here is moving those cups around a little bit. So this is called dynamic cupping here, dynamic cupping. It helps to pull on the tissue and lift the tissue in a different way. Again, you want to move along the fibers of that tissue. Really important to check in with your patient, make sure they're feeling okay, comfortable with the treatment here. And again, we're staying away from any areas of skin breakage. We don't want to go over an open wound. We want to make sure that we have good sensation in the area. Wonderful. So typically we only do cupping for about 5 minutes here. It's just safe for that tissue. Once you get to the end of your 5 minutes and you've monitored your patient the whole time, you're just gonna lift that little yellow thing there to release the pressure and allow the tissue to come back down to its normal resting position here. And as we see afterwards, we have a little bit of that redness there, but it is not a big old bruise. We haven't broken those blood vessels underneath the skin. It's just a little bit of that reddened area, pulling the blood to the surface, elevating that tissue. So again, here we're gonna release it. Good, yeah. Erin Mitchell is doing some nice effleurage here at the end for patient comfort. That redness there will stay around for a little while here. It should resolve within about 24 hours or so. And we can see those 3 areas where those cups did a lot of sitting.
Next, we're going to demonstrate some self-soft tissue techniques that we like to use with a lot of lacrosse balls, tennis balls, softballs. This one we're going to do with a peanut. So 2 common conditions that we like to use this kind of dual either tennis ball or peanut technique for is some self-soft tissue release to the suboccipital muscles right here in the back of your skull, and to facilitate a little bit of either self-soft tissue to the thoracic spine or some thoracic spine extension mobility. So what we're using the peanut for is either soft tissue or accessory joint mobility. If we don't have this fancy peanut available in the clinic, what you can do is take 2 tennis balls or have the patient acquire 2 tennis balls on their own. Take the 2 together with either duct tape, white tape, leukotape, whatever tape will hold. And that kind of gives you your self peanut fix if this isn't readily available to you. So the first treatment that we're going to go over is that self soft tissue release to suboccipitals. So if we remember our anatomy, our suboccipital muscles originate right here on the back of the skull and insert on various parts of that first cervical vertebrae, either at its transverse or spinous process. So what I'm going to do here with the tennis balls is I'm going to get them kind of right up on where that suboccipital region is. It's hard to pinpoint it exactly because those muscles are very small. But from here, I would ideally be on a firm surface so that the soft tissue tool is doing the release to my soft tissue versus going into more of a compliant surface like a soft treatment table or a bed. But once we've identified that suboccipital region, I can lay back here in either a supine or a hook lying position. And in this position, I'm letting gravity and the weight of my head do more of the soft tissue mobilization for me. Depending on how much pressure I need on my tissues or how I'm responding to just my head weight, I can add a little bit of a chin tuck to give it a little bit more pressure and expose a little bit more of those tissues in the back. And in this position, we can also practice some good diaphragmatic breathing to facilitate muscle relaxation and just kind of whole body relaxation in that point, where I can do some good breathing in through my nose and exhaling out my mouth. Next, we're going to demonstrate soft tissue and accessory joint mobilization of the thoracic spine. So similar to the suboccipital region, we're going to first identify the anatomy and get in the area of the structures that we're trying to target. So for thoracic spine, I can work anywhere from approximately T1, T2, down to about mid to lower thoracic spine, around T12, where my rib cage terminates. So in this region, if I'm just simply doing soft tissue, let's say to about the middle of my thoracic spine, I'm going to get the peanut so that the middle piece of the peanut is in the middle of my spine to allow my spinous process to kind of rest in that gap there. And both of the either tennis balls or peanut sides are more on the soft tissue or facet joints of the spine. And from this position here, if I cross my arms, I can open up those soft tissues a little bit, and I can either do some gentle kind of rolling up or down with my legs, or like at suboccipitals, I can just let my body weight kind of massage into those tissues. To facilitate some thoracic spine extension, I can stabilize my cervical spine here and do some small bend backwards at specific segments to facilitate a little bit of accessory thoracic spine extension. And in these positions, we can perform about 5 to 10 repetitions per level, and then move up or down depending on what levels that we're trying to treat. Next, we're going to talk about some self-trigger point release techniques with either a single ball compared to the double peanut that we were using before. So in selecting our tool for these, we can go based off of either patient preference, clinician experience, but generally how the patient responds to the different textures of the instrument or the ball in this case. So some of our softer, smaller tennis balls are a little bit more compliant, might feel a little bit more comfortable on individuals that are a little bit more sensitive in certain areas. Individuals that tolerate or prefer a little bit more pressure can use more of a firm lacrosse ball, softball, or even a baseball at that point. But in the clinic, typically we're using tennis balls to comparable size lacrosse balls or a larger lacrosse ball that has a little bit more surface area. So what we're using these for is to complement some of the hands-on trigger point release or dry needling techniques that we're doing as clinicians to facilitate the release of more myogenic type pains that are coming from either trigger points or tender spots in muscles. So some common muscles that we're using to treat these for are infraspinatus, levator scapulae, upper trapezius, rhomboids, thoracic paraspinals. Pretty much you pick the muscle. We have a technique that you can use to self-trigger point release with either a lacrosse or a tennis ball. And same goes for lower extremities, rectus femoris, hip flexor, adductors, glutes, anywhere from standing to prone or sideline positions, depending on the muscles that we want to hit. For the purposes of this video, we'll demonstrate an infraspinatus technique. So again, we want to go back to our muscle anatomy of where's the muscle that I'm trying to target. So infraspinatus is going to be right on the back side of that scapula. And for the purposes of getting the ball behind the back, it's not the most comfortable to try and self-posture just with the ball by itself. So typically what we'll instruct our patients to do is use either a pillowcase or a longer sock at home to allow the ball to just sit right in the bottom and make it a little bit easier to control where the ball is going to go, either over infraspinatus or if I'm biasing more thoracic paraspinals or upper trap. In instructing these techniques to the patient, once the patient has properly identified the muscle that we're trying to target, typically where I'll go next is I'll describe sort of a graded amount of pressure or force that they can apply to the muscle in through the wall. And again, I like these techniques because the patient is in control of how much pressure they're applying to the muscle, so they can apply a little bit less if it's a little bit more sensitive or irritable, or a little bit more as they progress through their healing process. So at this point, once I've identified that I'm on my infraspinatus and I apply sort of a mild to moderate amount of pressure, sort of like a good massage type of feeling, what I'll do is I'll start with either sustained 30 to 60 second trigger point releases where I'm just applying pressure through the ball into the muscle and no movements involved. And I like complementing this after trigger point dry needling techniques as part of our home exercise program to give the patient a similar self trigger point release technique to go home with. So after holding it on the trigger point for about 30 to 60 seconds, I'll do some small circles either in the clockwise or counterclockwise direction. And then I'll work that lacrosse or tennis ball in the direction of the soft tissue to do a little bit of a self-petrissage or kneading type of technique. And then lastly, if the patient is tolerating all of those well, I'll go for a little bit of a cross friction massage where I'll work the tennis ball across the direction of muscle fibers.
So the next instrument-assisted soft tissue mobilization technique we'll talk about is the Theracane here. So there are many different types. They all look kind of different. This one here is a pretty standard one. We typically only use that ball at the end there, at the end of the hook. I like to use this a lot for trigger point releases of the upper trap, maybe the levator scapulae, or even the muscles on the inside of the shoulder blade. So this is a good one here where first the therapist or the provider can help the patient identify the areas of muscle tightness by placing the Theracane in that spot. And then the patient can then take over holding that Theracane, allowing the patient to learn how to do this at home here. So once you find that tight, tender area, you place that ball at the end of the hook on that area, and you just hold that cane. Don't really have to pull down on it too much. Gravity really does the work here for you. And we just hold here for as long as you need. Typically at least 30 seconds, if not 2 minutes or so. Now you don't need a special cane to do this here. You can also just use a standard cane. As long as you have a little hook on the end there, it'll do the same thing. So again, you find that tender area of the muscle, maybe that tight knot in there. You apply a little bit of a pull, but mostly just kind of holding that cane in that area.
Next, we're going to go over some other instrument-assisted soft tissue tools, including the tiger tail, or sort of a self foam roller kind of stick, as you'll hear people describe it. So what we're using the tiger tail for is either a provider-assisted or a patient-driven soft tissue technique that we're commonly using on calves, quads, hamstrings, glutes. We can use it on the spine, not typically as much upper extremity, but again, with all of these techniques. We're using clinician experience, the patient's perspective. So in this demonstration, we're going to use Airman Paz's left gastroc complex here. And what we're using the tiger tail for is similar to what we would use a foam roller or the scraping tool for. We're going to scan kind of up and down the direction of the muscle fibers to identify areas of the tissue that are a little bit more tender. And with this tool, I'm using a little bit more pressure downwards compared to the scraping tool, where that was more of a superficial myofascial technique. And with all of these tools, keeping our muscle and bony anatomy in mind of, I want to work from the origin to about the insertion of that muscle tissue with the calf. I can do some isolated kind of tiger tail rolling over the Achilles, but it's typically not going to be as comfortable as working over the muscle belly itself. I'm going to be mindful of rolling over any bony prominences, and just like the other soft tissue techniques, I'm not going to do this technique over any unhealed surgical incisions, open wounds, infected areas, or if the patient has had a previous bad experience to this intervention.
So for the tiger tail here, we can do it ourselves as the provider, but we can also have our patients do it. So we're gonna, again, demonstrate at the calf there. I'm gonna have Airman Paz, she's going to do it right at the medial head of the gastroc. So when I'm instructing her, I'll say, okay, we're holding it behind our leg here. We're gonna roll up and down, just applying as much pressure as you can tolerate. Okay, so we're going to be at that medial area there with a little bit of a tilt in. You can also easily switch to that lateral head of the gastroc as well. So go ahead and grab that there, fish it behind one of those legs there, foot firmly on the ground there. This is a great way for the patient to have a little bit more control over what's going on. A good alternative for patients who don't quite want to invest in this but do have other kitchen tools in their home is to use a baking rolling pin that essentially does the same thing. It just doesn't have those little moving pieces, but a rolling pin can do the same thing.
The tiger tail of the marshmallow stick typically is going to be more cost effective both for the clinic and for the patient if the clinic and or the patient has the finances to be able to acquire or purchase a typically more expensive either soft tissue, hypervolt, Theragun type of tool. It's working on similar mechanisms to all of our other soft tissue techniques, but some of these newer massage guns give a little bit of a different either vibration or percussion stimulus, similar to some of our Swedish-based massage techniques of effleurage, petrissage, and tapotement. We're getting more petrissage and tapotement with some of our vibration and percussion techniques. So this is a hypervolt made by Hyperice. Again, more companies are making these now that they've become more kind of mainstream in sports performance and rehabilitation. But with all of these tools, it's another adjunct to our instrument-assisted soft tissue technique. So typically these tools will have different settings of how fast the head of the tool will percuss and vibrate from levels 1, 2, and 3 to increase the speed. And they also come with different attachments based on the area of the body that we're trying to treat. We can see this piece here might be more utilized for some spine soft tissue techniques or areas that are a little bit closer to the spine itself. We have different diameters and firmnesses of the tips here based on how sensitive the tissue is or how large or small the area is that we're trying to treat. So in this demonstration, we're going to use the Hypervolt as a progression from the tiger tail that we were previously treating Airman Paz's calf for. And I'll prepare the patient for this intervention by saying it's going to feel a little bit different than your regular soft tissue techniques. It's almost going to feel more of a vibration type of sense. And typically how I'll start is by not applying too much pressure through the head of the massage gun at all, but Similar to the scraping technique, letting the tool do more of the work for me. I can add a little bit of pressure if the patient's tolerating it well, and I'm just generally performing some broad sweeps from the origin down to the insertion of the muscle fiber. I can spend a little bit more time in areas where the patient perceives more tightness or closer to their area of symptoms if they're tolerating it. And my time or duration of treatment will be similar to most of my other soft tissue techniques. I'll begin with a little bit of effleurage, broad sweeps. I'll do some kind of local isolated trigger point release. And I'm really only treating for as much time as I need to elicit either a change in pain, a change in symptoms, to change that patient's perceived function.
So the final thing that we will discuss today is foam rolling. There are many different types of foam rollers that we can use. Some of them have been halved here for various purposes. Again, we have that vibrating foam roller with different types, different levels of vibration, and then just a classic foam roller, so many different lengths. Pretty much all the same size here. Foam rolling is really wonderful for decreasing muscle tightness, muscle tension, in a nice gentle manner.
So next up I'm going to show you two of my favorite places to kind of foam roll or give my patients to foam roll. The first one is the thoracic spine or mid-back. So this is good for people that have any tightness with prolonged postures, trouble with extension or flexion of their thoracic spine. The first way I do it is with the hands kind of behind the back, so with anyone that has neck pain or anything like that, you can kind of protect that area by just giving it a little support with the hands behind the head. And then just have them kind of slowly roll over the segments that are a little stiff. You can even add in just a little extension back over the foam roll to get a little extra mobilization there. And then for people that don't have too much neck pain and can tolerate their hands not being behind their head, I like to add in just the arms up overhead, because you're just going to get a little more bang for your buck and a little more extension and mobilization by putting those shoulders into full flexion. I like to use for people that have, some knee pain or tightness in the quads or hip flexors, kind of hitting that rectus femoris muscle, all the vastus muscles, and even a little bit of the TFL. So just anterior, laying down on it. You can kind of do both legs if people are a little tight or too sore, or you can stack one on top of the other and kind of focus more of the weight bearing as they go up and down that quad, and kind of roll your leg in or out to get more of the vastus lateralis on the outside of the leg, or the VMO on the inside of the leg, and you can work your way up closer to the ASIS to kind of get some of those more superficial hip flexor quadricep muscles.
There are many different areas of the body where you can foam roll, many different big muscle groups where you can get that nice effect. It's also really important, if you have the availability, to use a vibrating foam roller for a little bit of a deeper effect at those big muscle groups.